So in summary, fasting effects. Fasting decreases glucose, and it decreases IGF-1, which is insulin growth factor 1. And the lower the IGF-1, the lower your risk of aging and death. Fasting decreases blood pressure, heart rate, insulin, inflammation, oxidation, and total microbial load. It increases leptin, the satiety hormone. That's why after fasting, everybody thinks, oh, they're going to be ravenous and want to eat the world. No! You find you're more easily satisfied because your leptin levels have normalized. It increases insulin sensitivity and cellular stress resistance. That's the idea that cancer cells are more vulnerable to the body's immune system or exogenous treatments. And fasting and healthy cells are protected from some of the ravages of conventional treatments. It increases brain-derived neurotrophic factor, Bdnf. Bdnf is the chemical associated with prevention of Alzheimer's disease. If you take rats in a cage, one has the ability to exercise because it has a wheel and the others don't, everything else is matched. The ones with the wheel have dramatically lower dementia rates, and they've discovered it's because brain-derived neurotrophic factor goes up with exercise. It also goes up with fasting. In fact, if you look at all the chemicals associated with exercise that are thought to be beneficial, they also go up with fasting. Why is that? Why would exercise, which is vigorous, and fasting, which you're resting, cause some of the same neurochemical changes? Perhaps, my opinion is, because both exercise and fasting help undo the consequences of dietary excess. Exercise and fasting both are working to undo the consequences of dietary excess, and undoing the consequences of dietary excess is what we know is associated with improving the quality and quantity of our lives. Fasting normalizes the gut microbiota, it stimulates B-cell immunity, and it reverses all major abnormalities of metabolic syndrome. It is perhaps the most powerful tool that's appeared at helping sick people actually get well. So if you want to learn more about this, read our book, The Pleasure Trap. I think there's a few copies over here. There's also an audio version for those of you who rather listen than to read. Chef AJ did a great job of doing this in the studio, and it's really well done. You can get the discs, or you can get it on audio or any of those other formats. For those of you that want to know, is fasting something that could be useful to you? One of the services we offer at the True North Health Center is a free conversation with me. If you go onto our website, truenorthhealth.com, fill out the registration forms that gets me your medical history information. You can call me. I'll talk to you about whether or not this is something that might be relevant to you. I'll give you whatever suggestions I can. There's no cost for that. I have some cards. If people want to get them from me afterwards, you're welcome to do that. We also have a couple vegan SOS-free cookbooks, the Health Promoting Cookbook and the Bravo Cookbook. All of these you can read about these on our website for those of you that are interested. If you know a doctor that would like to do something worthwhile with their life and go to heaven instead of hell, they can come to the True North Health Center and complete our internship or residency program. There's no cost. We provide room and board and training to any doctor that wants to learn how to use fasting and a health-promoting vegan SOS-free diet to help their patients get well. They're with us either for a month, 3 months, or a year, depending on the type of program that they're entered into. We have about 30 doctors a year that are training now, so hopefully soon there'll be a lot more people doing something worthwhile with their life. Okay, I have apparently 9 minutes and 55 seconds, so if people want to ask some questions, I'll be happy to do my best to give you some answers. Why don't we start right here? I'll repeat the question. Okay, so the question is there any way to find a doctor in your local area that thinks on these lines? And the answer is yes. There are, depending on specifically what you're asking. If it's plant-based nutrition, there's groups now that you can get on the internet of plant-based doctors. As far as doctors that are experienced with fasting, the best strategy right now today would be to go to fasting.org, the website, and contact us, and we'll try to help you find the person most local to you. Unfortunately, as you can imagine, this is all pretty cutting-edge, innovative stuff right now, so it's really just starting out. And so, there's not a huge number. So we do have people in Florida, Ohio, Southern California, and the True North Health Center as well. So whoever's got the mic, we'll let you...
Sorry, he has to pick. Pick someone. Pick someone.
I'd like to know about your protocol for Parkinson's.
Okay. So, Parkinson's disease is an interesting condition. The only effective way of managing some of the symptoms of Parkinson's is the use of L-DOPA. And L-DOPA can come from drugs. It also can come from natural sources in the form of mucona. The problem with L-DOPA is if you give enough to control the tremor, you get extreme nausea. And the way medical care manages this is they give you another drug called cardopa. And it controls the nausea, but the problem is it irreversibly binds vitamin B6 and over a longer period of time leads to all kinds of terrible changes from dementia on down. So a lot of the increasing death rate you see in Parkinson's now may very well be from the medications that are used to manage it. There is an alternative way of managing it. Diet and fasting alone are usually not enough to resolve that problem, and so we resort to a protocol that was developed by Marty Hines. We have 2 doctors in our facility that have been trained by Marty Hines at using amino acid loading, nutritional supplementation in conjunction with mucona to manage the condition. We found it's very effective. Doesn't have the risk profile that's associated with the use of Sinemet and other medications. And so we augment diet and lifestyle change along with this exogenous treatment in order to manage Parkinson's. We've been very satisfied with the results. Yes, sir.
Are you having any success with, or what would you recommend for someone with chronic kidney disease?
Well, chronic kidney disease presents a particular problem. You need a certain level of kidney function in order to be able to do water-only fasting. So in our facility, if creatinine levels are over about 2.0, we typically won't do water-only fasting because the load on the kidneys from fasting can exceed its adaptive capacity. So in those cases, we have to go a much slower, gentler approach, which really involves using the whole plant food diet and lifestyle factors. And so it's not as dramatic and quick and exciting as water-only fasting is, but you can still get improvement. And sometimes we can get enough improvement that then the person's capable of going through fasting at a later point if they are able to make enough recovery. But severe kidney disease, as we mentioned on the profile, can limit your ability to do fasting. And that's one of the important things that you need to remember with fasting. It's a very intense process. And if you don't match the process to the appropriate patient, you can get some pretty bad outcomes. And I get those calls from people, well-meaning but misguided docs that have tried to use fasting in an inappropriate way, and they've really created a mess of things. We don't want that happening right now, because otherwise you get a lot of bad publicity about fasting when it's really people just doing stupid things. Yes, sir?
There's been very recent research showing that 12-hour fasting, between dinner and breakfast, increases beneficial bacteria in the microbiome. Have you looked at the relationship between 12-hour fasting and the microbiome?
Yeah, well, we recommend actually 16 hours of fasting as a routine for all of our patients. We feed patients at about 8:30. We don't feed people after 5:30. And we believe that that period of time may actually be beneficial. As far as the specific effect on the microbiome, that research is we're literally just waiting for the data analysis right now. It's fairly complicated because you're analyzing literally 1,000 different strains of bacteria, trying to understand what that means. It's all pretty virgin data. So we don't know scientifically yet what the results are. We know clinically that there seems to be some benefit, and we're assuming that it's tied to improvements here, but I can't say with certainty that that's true.
I wanted to know if fasting could help cure a hernia.
Yeah, no, fasting will not cure a hernia because a hernia is a mechanical distortion that's not going to be amenable to water-only fasting. So the inguinal hernias or that type of thing, that's not something that we see resolving in fasting.
And I want to know what's with kombucha. Is that alcoholic?
Yeah, we don't recommend kombucha.
Well, when you're doing a water fast, are you taking everybody off their medications? If someone was doing thyroid, so you take nothing.
So in order to fast, with the exception of a few exceptions like thyroid medications, dosing is modulated but may be left on. We're going to wean down all of the medications prior to initiating water fasting. Medications can become greatly potentiated during fasting, create all kinds of trouble. And fortunately, since most people are drugged for their diets, not their condition, what happens is as you change the diet, the need for medication is progressively reduced. Most of our patients were able to get off the medications and stabilize them in a controlled environment, and then we initiate water-only fasting. Sometimes we'll start with a more modified program like on juices or other things, 600 calories of vegetable-based juices, where we can safely wean somebody off. But that's why we have 4 medical attendings and a naturopathic physician as well. So we have every patient that comes to our center has an intake examination with a physician. They're seen twice a day by staff doctors, minimally. We have 3 educational classes a day. They're very carefully monitored in a controlled setting. And then everybody that goes through fasting has a period of progressive refeeding. And it's really done specifically to the limits of that individual. People fast from 5 to 40 days. We don't know ahead of time exactly how long that's necessarily going to be.
Thank you. That was great information. Any special kind of water we're fasting on?
We use purified water. We happen to use fractionally steamed distilled water because it's the purest water we can get. But you could use any highly purified water and likely get excellent results. We've had...
How about a back condition, a chronic back condition of about 40 years? Could that be cured? Well,
I don't think anything can be cured. Honestly, you can't cure obesity. You can lose the weight and keep it off, but if you go back to eating greasy, fatty, slimy processed food, you're going to get fat again. If you can't cure high blood pressure, you can normalize blood pressure and you may keep it down forever, but if you go back to the things that cause it, you're going to get it back. And back pain is no different. If back pain is contributed mechanically because you're overweight or detoned or have inappropriate core strength, unless you correct that problem and maintain that, you're not going to get rid of it. If it's an inflammatory process, fasting may be very helpful. If it's a mechanical process, we have doctors of chiropractic, osteopathy, physical therapy, trying to do manual therapy type things can be very helpful. So, back pain is a broad diagnosis, and fasting in some cases is a useful part of its treatment. Honestly, they tell us that the True North Health Center should be the last resort. Because oftentimes the back pain that we're seeing is the people that have been through all the conventional outpatient treatments and they're coming in. And honestly, our chiropractors often say you better treat them right away because if you wait till they're done fasting, there's often nothing left to do. Yes? Yeah, no stevia, no honey, no bee vomit. Here's the way you tell it. If you look at something and you don't know, here's the technique. You go inside yourself and you ask yourself, do I really want and need the substance? And if the answer is truly yes, you know. You can't have it. You get nothing. Thank you.